There we go. Recording is on. Okay, thanks everybody for being here. I know this was short notice for some of you. My apologies for that. Thanks for taking time on your busy schedule to join us this morning.
Okay. Oh, really?
The future of Milo. Yeah.
Remember, if you're not, mute your mic, folks.
Robot.
Social skills robot.
I have it. I have it.
You know that one, yeah. So I played with him last year for 3 days for free.
Remember to mute your mic, otherwise we can hear everything coming through from your end. I'm going to wait another minute. All right, so let's give this a try again. Okay, so this morning we're here to talk about the AW case, which is a case that was decided earlier this year. It involved Urbandale School District, Heartland AEA, and the Iowa Department of Education. You'll learn more about that in a few minutes. Specifically, we'll talk about a couple of things that came out of that case that have implications for our practice, and you'll learn about that in a few minutes. We'll talk about some things that we need to start doing, some things we need to stop doing as we move along. I will let you know that this case is on appeal and that we don't know what the final outcome would be, but the changes that we're going to make today they could be firmed up and say, yep, that's what you need to do, or it could we could come back in 6 months to a year and say, we'll go back to our old way of doing business, just depending on how that appeal turns out. But we will share with you information from that case, we'll share with you the implications, and we'll share with you some things we can do that we need to do for practice beginning right away. I will tell you that this is a work in progress. Because the paint is not dry, because that appeal will keep you informed as more information comes. In the particular case that we're talking about, AW versus Urbandale, Heartland, and DE, there were 4 counts on which the court found in favor of parents. The first count impacts how we look at discrepancy. The second count impacts how we consider a child's progress in general education. The third count requires the Department of Education to reimburse parents for tutoring. That's because the ALJ found that Heartland and the school district should have found the student to be a student with a disability, and they did not. And the fourth count requires DE to reimburse attorney fees, which is not unusual whenever a parent prevails. We'll explain more about the first 2 findings and really not go into the second 2. They're not pertinent to our practice. We will discuss changes in practice, and we'll share our initial thinking. And again, this is initial thinking. During our session yesterday, or after our session yesterday, we had a lot of questions asked. And so obviously needing more clarification, we'll be responding to those questions, asking for questions from this group as well, and respond to those questions as we can. And we'll try to clarify for people. And as you meet in your PLTs moving forward, you have an opportunity to look at practice and what it means. And again, bottom line, this is a work in progress. Ron, is this you?
Yes. Okay, and David, if you're okay moving slides, that would be great.
I'll be glad to.
So I want to take a few minutes as we're going to talk about some of the changes in practice that we'll be required to do. Just to give you a little bit more background on what actually happened, what were the issues raised in the AW case. We wanted to spend a few minutes talking about that. And so this first slide that you're seeing right now was one of the big issues. There's a few more. The big issue, whether the eligibility criteria and the procedures that were used, did they illegally restrict the scope of entitlement under IDEA? So that was the issue presented, and so there were you can see kind of four sub bullets there. Was this done by? And so these are the issues that were raised in the due process case. Netting a consideration of a pattern of strengths and weaknesses in performance achievement, or both, relative to intellectual development from the determination for the disability determination for students suspected of having a learning disability. So the term, if you read the case, the term learning disability as well as the term dyslexia are popping up in the case. And the whole issue of how do we know that that there are categorical disabilities cited in IDEA that we're required to identify, even though we have a non-categorical system in our state. And so this issue came up of whether or not the evaluation team omitted or did not consider strengths and weaknesses. The second sub-bullet there is an area where probably some of you have seen issues before coming from families, but it was failing to give good faith consideration to clinical diagnoses of a learning disability, in this case, by qualified medical professionals. And so the issue of, is it a medical disability or is it an educational one, that was raised as well under this broad issue of potentially restricting the scope of entitlement. The third one is one that really comes into play and what we have to do based on the findings that you'll hear about shortly. Failing to make an individual determination of need by requiring a significant discrepancy. So looking at norm or grade-based performance standards. So that was a concern raised that AW was not identified, in fact, because through several evaluations, the position of the AA, the school district, was that there was not significant discrepancy, and so eligibility didn't happen. But that the concern here was the issue of, did that restrict the scope of entitlement? And the last sub-bullet here, narrowing the definition of special education and specially designed instruction so that it includes only instruction and services that exceed the capacity of general education. Well, that phrase may sound familiar because that phrase appears in the last question on our state's EER. It asks us kind of in conclusion, do the needs of this child exceed the capacity of general education? But the issue was raised in this case, does that narrow the definition of special education? In other words, could it be that some students, the supports they need can be provided through general education or in the context of general education, and could that student still have a disability? David, could you shift to the next slide for me, please? So that was the first big issue with kind of some sub-issues there. Then on the slides you're looking at now, you can see a couple more. This next one, whether or not the respondents violated procedural requirements of IDEA by allowing the eligibility determination to be made by the AEA rather than a properly constituted eligibility team. So that topic was explored there. Was the decision made very heavily by the AEA versus a broader eligibility team? And then finally, just the big issue, did they violate child fine by failing to identify AW? In other words, what David mentioned earlier, was this a child that should have been found eligible for special education? So if you read the kind of court summary of the case, it's very interesting reading. It's about 70 pages. There's a link here in this PowerPoint, as well as in the document that you'll get shared with you. Some of you have that already, but you can see this where it says many complex issues explored. There were just a variety of things in the case. There was issues of homeschooling. You'll read about AW's parents having homeschooled for a number of years prior to coming to school, and then this issue of suspecting disability. The student received tutoring outside of school at different times during when this case was going on. There were multiple outside evaluations, several initiated by the parents, amidst all the school evaluations. One was a second opinion initiated through the AEA. You'll see medical conceptions of dyslexia, educational ones. We shared yesterday in the meeting to some of the psychologists that were listening in. In one of the evaluations, a licensed medically based speech language pathologist diagnosed developmental dyslexia. So we have that in there.
Diagnosed?
Kind of competing with a an AA team that indicated not eligible. So you also see a diagnosis of nonverbal learning disorder that came from University of Iowa. So very complex case, but after all, throughout the due process, there was an order of relief in finding in favor of the parents. And David, I think you had started to pull that up. So this is the large document, the 70-page document. But at the very end, you see kind of the conclusions, the things that we need to respond to. So based on the findings, the Iowa Department of Education shall not require the AEA and district shall not employ that a finding of disability under the contingent upon the existence of a significant or severe discrepancy between the child's performance and age or grade-based standards. So that issue of discrepancy, that has been part. We have progress, discrepancy, and need in our process, but the discrepancy part is being called into question. The second one, the Iowa DE shall not require, and the AEA and district shall not employ a definition of special education for purposes of determining whether a child needs special education as a result of a disability that excludes instruction adapted in content, methodology, or delivery to meet the needs of the child merely because the instruction is within the capacity of general education. So going back to that issue mentioned earlier, could it be that the child does have a disability, but their needs could be met within a general education context? And then the last two there were the reimbursement issues that was found in favor of the parent. They did receive out-of-pocket expenses for tutoring and for attorney fees. So that's just a kind of a brief summary of the case, and then let's move forward into some of the actions that we'll need to take to respond from there.
Thank you, Ron. I'm going to ask people again if please mute your mic. We are hearing a lot of background noise. Thank you. So last week, near the end of our administrative meeting, this email came through. An email came through from David Tilley, Department of Education, with a memo to the AEA Directors of Special Education in regard to this particular decision from the ALJ. And in this memo they sent to us, there were a couple of things that were addressed. And they come right out of that order of relief that Ron just shared with us. And you can see there in those 2 points, Iowa Department of Education shall not require, DE and district shall not employ criteria make a finding of disability contingent upon existence of a significant or severe discrepancy between child's performance and age or grade-based standards. And then the second one has to do with that general education piece. And then down below, you can see the language that is underlined there. Staff shall no longer use the following as a determinant factor in an eligibility decision. Cutoffs or approaching a cutoff for discrepancy times discrepant, etc. Then the second page talks about the general education piece. It goes into a little more detail about some other things like a child needing to be exposed to appropriate instruction prior to ever being found a child with a disability. Some of these things we are continuing to chew on, think about, and what exactly are the implications for practice. And as I said at the outset, this is a work in progress, and so we're going to give you our best read on this as we have it for today. So the first finding, its implications, that first bullet point came right out of that memo. What does that mean in terms of documentation? It means that that last column of that last column on the EER relative to discrepancy, we will not fill that out. We will actually indicate see below, and in just a moment we'll show you an example of that. We will no longer use the times discrepancy ratios, percentile ranks as an indicator for significant / not significant discrepancy. And ultimately, you know, if you read between the lines what it's saying, don't use a single score to indicate if a child is significantly discrepant or not. You know, and this is just a standard practice that's been around for a long time, not to use a single score to say that a child is a child in need of an IEP. We really need to look at the data in totality and not just one number. So we will not use the phrase significantly discrepant or severe discrepant at this point forward until you hear otherwise. We will focus more on analyzing the student's profile of strengths and weaknesses. Now, what does that look like and what does that mean? We will touch upon it just barely this morning, but again, as you move out into your PLTs over the coming months, that is a topic that you'll take up for professional learning. What's more important in our practice is to develop the EER to show what you have learned from the diagnostic assessment. So we really have to get good about operationalizing what the student's academic performance looks like given all that we have seen and all the data that's been collected. So we really are going to have to be very global in our thinking as we look at the data and move forward. We can no longer focus on a single cut score. So again, we'll just need to be a lot better about developing our qualitative description of the student's performance, what that looks like. So I'm going to turn to Stephanie and Carissa to share with us the Sammy Sloan example, if I can get to that. Carissa or Stephanie?
Is Chris on?
Yeah, that's me. Sorry. I was talking about with my mute on, so I apologize. If you'll go to page 6, this is just a visual example of what we're asking you to do. In the last column where it says discrepancy from expected performance, as you can see, all of the discrepancy that had been figured is no longer there. What we're asking you to do is now type the word see below. And if you scroll down a little bit further, David, in the questions below the table is where you're going to start qualitatively writing out how students, what their strengths and weaknesses are, what that has looked like in their assessments that you've listed above, and what you've gathered as well throughout the time in during the assessment.
Over here.
So we are providing this example for you to be able to have reference to our interpretation.
In order. It doesn't work.
Thank you, David.
Thanks, Carissa. Hey,
Yeah,
if you just came on, make sure you mute your microphone, please. We can hear you. Thank you. I'm sorry, Carissa, you may have been talked over there. If you could hit real quickly what you were saying there at the end.
Yes. So what we have here is an example for you to use right now. As we've discussed before, this is going to be a work in progress. This is how we qualitatively want you to summarize your findings from the assessments that you typed up in the table, but also there may be changes coming as we learn more.
Okay. Thank you. So the second finding and its implications, we will no longer be discussing the capacity of general education when we look at the student's need for special education, because ultimately what the case was saying was that a student could be receiving all or part of their special education in the general education environment. So just because general education can support it does not mean the student isn't a child with a disability. So we shall no longer employ a definition of a special education that precludes a child from being identified just because they can be instructed in gen ed. And during an evaluation based on RTI, a student is found to be disabled and able to progress through the gen ed curricula only when provided with one or more specific intervention. Then that child meets their needs resulting from the student's disability. Then the child is eligible for special education. A lot of words, but basically, again, just because they're getting their instruction in gen ed doesn't mean they're not a child with a disability under this case. And we will work through what that looks like a little bit this morning. Instead of looking at the gen ed capacity under the need, we need to focus on looking at child's skills, summarizing what we've learned about them, about amount of type of research support and strategies that were implemented and what they might need. We will need to talk about specific interventions and strategies that worked or did not work, and we'll need to describe instructional modifications and services or accommodations that may be needed. So again, being very descriptive of what we have found about the child regarding what works for them. So we can't rule out special education because gen ed can't support an intervention. Now what? Stephanie, is this one yours?
Yep. So for that bottom part of our EER, looking at the needs, the curriculum, instruction, and environment, just making sure, which I know a lot of us do, is kind of bullet and list what those needs are for the student specifically, and avoiding that general education language. So that final question that really sums up everything that we know about the EER: which of the above needs, if any, require services and supports that exceed capacity and obligation of general education? We are asking you guys to just use this statement, that at this time the eligibility team will meet to review so-and-so's assessment data and identified educational needs to make that decision. So kind of avoiding it altogether just so that we don't speak to that capacity in gen ed.
And it really does put the burden of deciding about eligibility on the team, and it takes the lens, the focus off of AEA staff, where sometimes people will turn to us and say, is this a child with a disability? Like we're going to give them the answer. So the conclusions of this are, the results of the AW case have implications for our work. There are some things about our practice that we must change. And the we must change is not just us, but it's all AEAs. And I will tell you, the directors of special education are meeting next week about this very topic. I've been collaborating with a couple of other AEAs about what they're doing and sharing what we're doing. We all need to be on the same page because the special education procedures are an AEA system procedures. It's not Green Hills. So over the course of this year, we'll take time to evaluate our practices and see where we can improve things and focus on what we can improve. And again, we'll need to be looking more at how we describe a student's strengths and weaknesses and its impact on their educational functioning. And again, we won't do this alone. We'll work with our colleagues across the state. I want to thank Carissa, Ron, and Stephanie for their help and support in thinking and putting together this information for today. This really was a team effort and will continue to be a team effort as we move forward. There is a link at the bottom of this slide. If you click on that, it will take you to a document that has information that was contained in today's slides. And I believe you received an email yesterday, or most of you would have. There's also a link to the frequently asked questions document at the end, where you can go in and you can see a lot of questions have already been asked and some questions have been answered. And you'll just find the next open line and you'll put your email address, write your question, and then we'll come back as a team and we'll put down an answer over here in column C. I'm going to stop now and turn to my team. Ron, Stephanie, Carissa, anything we missed this morning?
I don't think so. Just to really highlight to attend those regional PLTs. I know our SPED rep ones are coming up in the next couple weeks, so we'll have a chance to talk through some of this and make sure we can get your questions answered as quickly as possible. So that would be my only plug.
Thank you, Stephanie. Ron?
No, I think we covered the highlights. I know we have a small group meeting on Friday, and part of that time will be to tackle some of the questions that are appearing on that Q&A.
Okay.
But it is I see a few questions popping up in the chat here too. Someone asked if there'll be better examples, one specifically for early access. I mean, there'll be lots of questions, but right now it's essentially brand new information from this memorandum last week. So as we work through it, I think we will have more examples, and even I think maybe even some of the PLTs that are working, as Stephanie mentioned, we'll be able to work through and get some examples that are going to be helpful to people.
And I'm getting some back channel. People are saying they can't access certain documents. I will make sure it's open to everybody. Anything else for the good of the order before we sign off? I know this is probably still seems pretty gray, a little muddy, but we will try to make it a little more black and white as we move forward. And provide you with more information. We'll probably be tapping some of you also to help with development of some good examples around this topic. And it really is more about the practice than it is about the documentation. Even though we focus a lot on documentation today, it really is about our practice of what we do. And so let's just keep our focus there too. I want to thank you all for being here this morning. I want to thank you for being a great staff and attending to this matter. And I hope you have a great Thursday. Take care.